Hi everybody, my name is Rhys. I'm one of the audiologists here at Audiology Associates. Now we can see inside this particular ear canal, this is one of Taylor's patients. If you're new to the videos, I've normally got my colleague Taylor sitting next to me, but he's unable to voice over today. So just me on my own in my casuals because I've come in all day off. So what you can see here is a very, very thick layer of keratin, so hardened skin right on the outside part of the ear canal. This is really, really common in ear canals because the skin migrates out from the deepest most part to the outermost part of the canal. When it does that, the skin ages, all those skin cells, and they dehydrate a little bit. So they end up becoming much, much harder, and that collects on the outside part of the ear canal. Lovely little chunk of wax there just on the outside edge. Now he's switched down now to a little fine end. The reason for that is when you're removing skin from ear canals, especially when it's very sort of floppy skin like this one, so very mobile skin, what you tend to do is go down to a much, much smaller tube to reduce the risk of that skin vibrating up and down in the end of the suction tube, which is something called clarinetting, which is a very, very sharp, shrill sound, so not particularly nice one to hear. So he's just clearing the outside edge here. There we go. You can see him working his way around the canal, getting rid of all those excess bits of wax and skin that we can see. Just this last little bit at the top here. There we go. You can see a few little hairs inside there. Sometimes that happens. You can see with these denser hairs around the outside edge. If somebody's trimming the hairs in the ear canal, you'll tend to find that happens. But it looks like there's a little flap of skin just at the top there. We just, as Taylor went in, the endoscope just clipped the end of it and it just folded down over the end of the endoscope there. There we go. He's peeling this away. And it's not unusual to get these peels inside ear canals, guys, as they start to come down. You know, we said about the skin migrating like almost like a conveyor belt. So it's not unusual to get these long strips of dry skin that form. But yeah, there's quite a lot of scarring on this particular eardrum. Now, Taylor did tell me that this particular patient had had something called a tympanoplasty before. So the tympanic membrane is obviously the medical term for your eardrum. So a tympanoplasty is an eardrum repair. And what usually happens if somebody's had quite a large perforation that's not healing itself, because a lot of perforations, contrary to popular belief, will actually heal themselves. So if they're small enough, the skin can knit back together. But if it's quite a large perforation, then they need a bit of surgical intervention. Basically, they graft the eardrum then, so they patch that hole. It varies in effectiveness, depends on the sort of the underlying cause of the perforation to start with. So if somebody's had lots of problems with ear infections and things like that, you may find it comes back again. But for a lot of cases, it does tend to work really, really well. So what he's got here is this thick layer of skin, all dead skin, sitting at the base of the canal. This is going all the way around the canal. And then he's got this really, really thick layer of wax right in the center there, which is just blocking everything up. So imagine you've got this really tough kind of exterior, this thicker, sort of harder layer of skin, and then this really soft, squishy, mushy layer in the middle of there. And that's what's going on in this particular ear canal. When the wax is like this, it does tend to form really, really good blockages. So it really blocks the patient up and they don't hear particularly well. So he's introduced a little bit of olive oil. I can see that because he's just tidying the excess oil up from the outside edge here. Always difficult when you've got these denser hairs on the outer portion of the ear canal, because this tends to happen. When you come close to the hair, there's usually a layer of olive oil that's coated those hairs. So as you push in with the endoscope, that hair smears over the front of the endoscope there, and that's what causes that sort of blurring effect that you can see. But he's still sticking with the fine end here, just working his way really slowly down the canal, just lifting from the outside edge. Oh, back in now. This is the bigger tube. So this is the standard size ulnar tube we've got in here now. Gives a lot more suction power. Great for these bigger chunks. And you can see the difference it makes there. Gets a grip on the edge and the whole plug just turns a little bit as well. There is actually a second patient in this compilation, guys, so make sure you stay tuned for the second patient coming up as well. Also one of Taylor's today. You're going to get a mix of mine and Taylor's, I think, tomorrow and... No, tomorrow's... Yeah, tomorrow. And that's a members video, guys. And then I'm back on Wednesday. So it'll just be me for Monday, Tuesday, Wednesday next week, and then back to normal with Taylor again after that as well. So just pulling this, look at that deep deep section. Look how it arcs around down to the eardrum there. Very, very dry. So Taylor's got to be a little bit more cautious here. When you're pulling down from the top, imagine that bottom section can kick up and it can feel a little bit uncomfortable. So he really wants to detach, which is exactly what he's doing here. He's trying to detach from that one side of the canal wall. Just trying to pull that top section down and across just to free it up. Is he going to be able to get a good old grip on this top section? Oh, there we go. It's starting to move. There we go. It's nearly there. You can see how it's starting to rock back and forth. He's getting a little bit of detachment. I would say it looks like it's attached on the top right corner there. So he's just working this. Hard to tell because you've got this almost granulated wax, this really kind of, I use the terminology, it's like a sort of a creamed, butter sugar mix. It's that kind of consistency. You've got these kind of, it's liquid, but you've got these almost grainy lumps in there. And that's always really, really sticky wax. It tends to really adhere well to the canal wall. He's managed to pull that top right section down there. So just working this last plug. It's on its way. Let's have to use the bigger tube now. Use the fine end there just to reposition that plug. As I said, it doesn't quite have enough suction power. So we switch back up now to the larger of the two tubes. And this is going to give us a little bit more power, but it's a bit of an awkward shape. Remember I said it arced around? So as you're pulling this down the canal, we all have these two bends and you will find it'll just hook on to a bend sometimes. And as you're pulling this front section, you're always conscious of the direction of that back end of the plug as well. But nice big chunky plugs there. And looking nice and healthy. So eardrum looking much, much better. Just a little bit of staining on the sides, but other than that, it's good. So 2.5 centimeters, bang on 1 inch there for the lovely Mr. Taylor green. Make sure you stay tuned for the next video, guys. It's coming up, well, there it is. Now, I don't know much about this one because this is obviously Taylor's patient. So I'm going to talk this through blind like you're watching it for the first time, so am I. So what we've got here is very, very soft wax right at the entrance. Ooh, coming away easily there though. A little bit of dry skin to that left-hand side. Standard size ulnar tube in play here. And good grip there, a little bit of a wiggle. Almost looks like we've got a little bit of skin arcing up under from the bottom there, wrapping around the base of that plug. But other than that, that looks good. It's coming away nicely. Big old plug out he comes. Oh, a little bit of the back end there. I think there's a bit of a mushy layer that looks much further in. Oh, yeah. Okay. So we can see that really thin layer that comes around. Now, what's he going to do? Is that going to move as one? Oh, that would be lovely if that moved as one. Is that going to come away? Thick layer of, hard to tell at the moment whether this is skin or wax. Let me just put this out of the way here just so I can see a bit better. I think that's a mixture of skin and wax. I think we've got this sort of tough skin underlayer. Now what's going to happen to that piece over the eardrum? Is that going to come away with this layer? A little bit of humidity there. It's either humidity or there's a little bit of oil's gone in. It's just coated the camera. Yep, I think, is that all going to come away as one piece? That would be really lovely if it did. I don't know. I was going to say that looked like it was more to do with that outside edge. So where do we go here? Do we lift this front section or go straight to the back? Now this may well concertina. As he pulls this, it may well unravel because it almost looked like it was a lot of skin compressed into one area. Yep, you can see a much, much thicker layer. Ooh, where do you go now? Do you lift from the side? I would probe that side there on the right hand side. I'd drop back towards the camera a little bit and probe there. Oh, but that's good technique. That's good technique. You see how then he passed over that little layer. Now I would have lifted from the front, but what he very cleverly did there, in kudos to Taylor there, is he dropped behind and then drew the suction tube back along the surface. And what that did is just lifted that edge. So that was a really, really nice little piece of suction work. Wow, that is a lot of skin down there. Just give him a quick tidy up around the outside edge. Okay, so we've got the section to the right and we've got the section to the left. Left is easier to get a grip on just because it's slightly wider. Is that going to come away nicely, or is that going to be a pain? Oh no, that came away really well. Now, skin doesn't concertina up like this this deeply inside the ear canal. So I think the patient has historically used some cotton buds. It's lifted this dry skin off the canal wall, which is what's caused it all to kind of bunch together. How much is in that Rhys? Oh, look at that peel to the top right there. Do you see that lovely peel all the way along the top section? Nice, lovely. Now, what you're left with there, you can see some staining there to the top, sort of top portion of the eardrum, up near that pars flaccida area. Basically, if you try and get that off, it's very, very thin and sticky wax. So I understand why he's left that there. Patient uses a bit of oil for the next couple of days. That's going to come away off that drum really well. So we've got 4 centimeters, 1.5 inches there of mixture of dead skin and wax. Well, guys, thank you so much for watching the video today. We really, really do appreciate every single person that views the video. If you don't mind, if you could hit that like button for me, that would be absolutely fab. It pushes the video out to lots more people, so more people can see these amazing wax videos as well. And if you thoroughly, thoroughly enjoy it, you could always consider subscribing. And if you really, really, really enjoy the videos, you can also consider becoming members of the channel, and you'll see more videos like tomorrow's video, which is coming up for the members as well. But as always, guys, take care of yourselves, take care of your ears, and most importantly, take care of one another. I shall see you for members tomorrow, and for subscribers, I'll see you for Wednesday's video. Bye, everybody.